Starting a family is a dream for many, but for some, the path to parenthood can feel like an uphill journey. If you've been curious about what infertility is, what causes it, and the various ways it can be managed, you're in the right place. Infertility can be a tough journey, but with the right information, support, and medical guidance, many people are able to find solutions that work for them. So let's break it all down. So first off, what exactly is infertility? Medically speaking, infertility is defined as the inability to conceive after 12 months of regular, unprotected sexual intercourse. For women over the age of 35, this period is shortened to 6 months due to the natural decline in fertility with age. Infertility can affect both men and women. Let's look at some common causes, starting with female infertility. Ovulation disorders. One major cause is problems with ovulation. Conditions like polycystic ovary syndrome or PCOS or hormonal imbalances can make it difficult for an egg to mature and release properly. Fallopian tube damage. Blocked or damaged fallopian tubes can prevent the egg from meeting sperm. This can be due to infections like pelvic inflammatory diseases or scarring from past surgeries. Endometriosis. Where uterine tissues grow outside the uterus, it can affect fertility by causing inflammation and scarring, especially around the ovaries and fallopian tubes. Uterine or cervical issues. Problems with the uterus or cervix, such as fibroids or cervical stenosis, can also interfere with conception or plantation of the embryo. Age. Finally, age plays a significant role, as egg quality and quantity decline with time. Now let's look at causes of male infertility. Sperm production issues. One of the main issues is poor sperm production, either low count, low mobility, or abnormal shape, often influenced by genetic, environmental, or lifestyle factors. Hormonal imbalances. Hormonal issues can impact sperm production or function, including imbalances in testosterone or other hormones essential for reproduction. Blockages in the reproductive tract. Blockages from previous infections, injuries, or genetic issues can prevent sperm from reaching the ejaculate. Lifestyle factors. Smoking, excessive alcohol, poor diet, and high stress can all impact fertility in men and women. Additionally, exposure to heat, radiation, or toxic chemicals can also affect sperm health. To identify the cause of infertility, both partners may undergo specific tests. Common tests for women include blood tests to check hormone levels, ultrasound exams, or an HSG, that's a hysterosalpingogram, to assess the fallopian tubes. Men typically undergo a semen analysis to check sperm count, motility, and shape. Let's talk about treatment and management options. Infertility treatment varies depending on the underlying cause, and every couple's journey will look different. First is lifestyle changes. Sometimes making healthier lifestyle choices can improve fertility. This includes maintaining a balanced diet, reducing stress, limiting alcohol, quitting smoking, and staying active. Often a few changes can make a big difference. Second is medications. There are medications available to stimulate ovulation in women, like Clomid. And for men, there are options to balance hormone levels if needed. Medications can be the first step for many who need a little extra help with timing and hormone balance. Third are surgical options. Surgery may be recommended in cases where blockages, fibroids, or endometriosis are interfering with fertility. Procedures can often improve the chances of conception. Fourth, assisted reproductive technologies. One of the most well-known options is in vitro fertilization, where an egg and sperm are combined outside the body and then transferred to the uterus. Other options include intrauterine insemination, where sperm is placed directly in the uterus during ovulation. Number 5 is alternative options. For some, fertility treatments aren't successful, and they turn to options like surrogacy, adoption, or donor eggs and sperm. These paths can still provide the opportunity to grow a family. Infertility can be emotionally challenging, and it's crucial to remember that you're not alone. Joining support groups, seeking counseling, or talking with others on a similar journey can provide comfort and guidance. Thank you for joining me today to learn more about infertility. It's a complex issue, but the good news is that there are more treatment options available now than ever before. If you or someone you know is struggling with infertility, reach out to a healthcare provider to discuss options. Remember, every path is unique, and with the right support and information, you can find what works best for you. Don't forget to like, subscribe, and share this video if you found it helpful.